Hey again, everybody. This is Dr. Langlois, or Doc as I am known to the Thorough fan community, and I wanted to jump on quick again, answer a couple of more questions that have popped up throughout the day following, of course, the tragic death of Medina Spirit following a 5-furlong workout out at Santa Anita that was a sudden death type of work. Again, it was not a catastrophic injury. It was a sudden death. As they term it, which usually involves some sort of cardiac episode, a fatal arrhythmia leading to a heart attack, or potentially a rupture and a bleed out from a very large vessel, such as the aorta, or a very large vessel in the lungs, or something like that. But a lot of the questions now have focused specifically on what they are going to be testing for. And of course, this star-crossed horse has had quite the history when it comes to testing following, of course, his post-Derby sample coming up positive for betamethasone. So immediately the question starts circulating, are they going to be testing for that? Are they going to be testing for other drugs? Is the testing protocol different in these cases? And really, the simple answer to a lot of those questions is I don't know, and I really think there's a lot of people out there that don't know. Usually the lab itself is the only one that knows specifically what drugs they are going to be testing for in a specific case, and they are not going to publicly make that known because obviously we want to keep that a secret, so this way trainers who are thinking about potentially cheating don't necessarily have an upper hand of knowing what a lab is going to test for and not test for. So, as was kind of mentioned in some of the articles, and I mentioned quickly in the video previously, they are going to get samples of blood, urine, hair, and they're going to try to get as much of that as they possibly can, and usually you try to get that as soon after death as possible to be able to preserve those specimens for future testing. When the necropsy is done, they probably will take samples of tissue as well, usually the liver, the kidneys are the big ones where they may look for evidence of buildup of a certain drug or metabolites of these drugs, the breakdown products of certain drugs. But as far as exactly what they are going to test for, I really don't know. They, of course, are going to test for all the regular things that you normally would test for in either a post-workout or a post-race sample. So that's kind of across the board, different types of steroids, different types of potentially non-steroidal anti-inflammatories, such as betamethasone or banamine or other things like that. They will probably test for the litany of drugs or screen for the litany of drugs that are considered prohibited substances and should not be in a horse's body. I do not know if the testing protocol or the toxicology protocol is different for a horse that suffers a catastrophic injury or a sudden death on the track as compared to a horse that is just going through a normal post-race or post-workout blood sample or something like that. I would imagine it would be, but again, only the lab really knows that, or probably the veterinarians or the medical director out in California would be able to answer that question to the best of their knowledge anyway, but I do not have that information, and there's probably very few people that do. One of the drugs, of course, that has popped up, of course, is, well, are they going to look for EPO? Are they going to look for any evidence of blood doping agents or androgen promoters, growth hormones, things like that? Again, my guess is they probably will screen for those types of things. It can be very hard to find some of those substances, basically because they don't last in the body very long, and that's why for trainers that are accused potentially of blood doping and cheating and using other methods, they usually are found to be doing a lot of these things during the training cycles of these horses, not on race day or very close to a race day where the drug might be able to be picked up. Specifically with EPO, that was a big thing, partially because they were doing it during training, so they didn't really have out-of-competition testing when EPO first kind of came on the scene. And two, the compound itself, EPO, after it's injected, it doesn't last in the horse very long, so it's very hard to detect. There are very different formulations of it now, so it's hard to detect, and you have to constantly be changing your testing protocols for that. So again, I'm sure there's going to be testing of every substance they possibly can in this particular case, just because of the high-profile nature of it. But again, everybody's going to have a little patience. These tests do take time to run, and a lot of it is going to depend on what they potentially find in pre-screening samples, and hopefully the samples that they collect will be good enough to be able to run some of these tests on. And I imagine they would be. The veterinarians out in California are very good, and they're of course going to collect these samples as quickly and as best they possibly can. So hopefully that answers a little question as far as what they might test for or not test for. Again, it's probably going to be an expanded screening protocol, especially considering this was a sudden death on the racetrack. But the lab probably is really the only one that knows exactly what they're going to be testing for. And again, these tests and all these results are going to take a little time. So we are not going to really know anything tomorrow or the next day. It's probably going to be a couple of weeks to maybe even a couple of months before we get the full results. Santa Anita has said that once their results are found, that everything is going to be put out in the public domain. So hopefully that transparency will be there, but we're just going to have to wait and see and find it. So I'm going to try to keep abreast of this as best I can, and answer any other basic questions that people may have. Again, drop them right in the comments, and I'll try to answer them as I go for things that I know. And if I don't know, I will try to find the people that can get the answers for you. So hope everybody else is doing okay, especially, obviously condolences to all the connections of Medina Spirit. And I'm going to be here at the Global Symposium on Racing for the next 2 days. We'll see if there's any chatter about that, or if any of the panelists mentioned anything about it, or especially how HISA might address some of these issues, because that is going to be the big topic, at least for the morning sessions tomorrow at the symposium. So until then, I am Doc signing off, and we will be chatting with you again real soon.